Okay, so today we're talking about a 31-year-old female. This is a real life story that just came to us in October of 2024. So just 3 months ago, 3 months ago. And quite a profound case because a 31-year-old, the bad news is she was quite sick. The good news is, spoiler alert, that she got a lot better really quickly and then worse again. So let's go through her story, a little bit of a backstory. I know her mom, and her mom is the one that kind of pushed her to come see us. She was quite skeptical of functional medicine, as many people are before they come to see us. So, Cerise, walk us through her kind of timeline, what brought her to us and what happened.
So she, back in early 2000, she had asthma growing up, track and field in high school, and was in and out of the hospital for asthma, blamed it on the fact that her father was a smoker.
Which does make things worse, right? But when we hear asthma, Paige, what do we think?
Mold.
Yes, we always think mold. So already, way back in the year 2000, 25 years ago now, we already worried she had her first mold exposure. No proof in it, but suspicious.
Exactly.
Okay. Then it went away, right? Just asthma just kind of poof, got better.
Yeah, and then in 2009, she started smoking, started doing Juul vapes, nicotine gum. She decided to quit in 2017. She switched to exclusively vapes, had to use a nebulizer to travel, but hasn't used an inhaler since she actually quit smoking actual cigarettes.
So that would also kind of fit a mold exposure. Like she was, yes, as she got out of the cigarette smoke of her dad, most likely the mold home, she still had some asthma, but was able to smoke herself without severely triggering asthma. So that kind of tells you that she had a mold exposure that created the asthma, but she got out of the mold, but kept the kind of risk of it, but was able to smoke for 8 years before having to stop. And if she only had to occasionally use an inhaler while actively smoking, that's not bad at all.
Yeah. So in 2020, she got pregnant and had severe vomiting and just could not hold anything down. She feels like in her story that this was the trigger for many things going wrong, to the point of bringing her to our clinic. So in 2021, she says she became allergic to mulberries.
I didn't even really know a mulberry was a real thing.
Yeah.
I'm ashamed to say.
She said she went into anaphylactic shock.
Didn't she say like wherever she was, they were native or something? Like why is she?
Yeah, she was eating like a dried snack, and so it was.
Have you all ever had mulberries?
I don't know.
I don't think so.
Yeah, me neither.
I'm not sure.
It looks like. I'm gonna
Maybe.
Google it
So
real
much.
quick.
Yeah.
Mulberry. Sounds like something on Little House on the Prairie.
I looked up the exact snack and I was like, okay, it looks pretty innocuous, but
Apparently, it's also a purse.
oh, interesting.
Oh, it looks like a long blackberry,
Oh, okay.
like a long one.
That makes sense.
Okay,
All right.
moving on.
So she got really bad postpartum depression, was put on Zoloft and Xanax. Of course, it made her feel off. She wanted to get off of it because she was having weird depressive episodes.
And that's about 4 years ago now, getting closer to the current story.
Exactly. In 2022, she
So about
mentions
3 years ago.
that she was living in a potentially moldy place, and that her and her child were both having respiratory issues.
And at that time, I mean, she's telling us it was potentially moldy, but at that time, they weren't really thinking anything of it. So this is her
Exactly.
kind of reflecting, us asking her, and her noticing, like, yeah, we did have respiratory issues. Now they say that both of us.
Yeah. So in 2023, in an apartment in Dallas, her daughter needed more attention, was able to work from home. In October, she started going to her boyfriend's apartment in Dallas and moved into her own house in Rusk, wherever that was. So she split time between the two places. November.
This is where it gets juicy. So we're
Her left
2
wrist
years
pain.
ago, November.
Yeah, her left wrist pain started, but she did have it during pregnancy. It just got worse to the point that she couldn't do like downward dog, as far as like a yoga pose. She couldn't do some of the things that she had done before. And she was pretty active. She was did like
parkour.
did parkour,
Skydiving.
skydiving, extreme sports.
And she said she was like really parkour, like she was
Yeah.
doing the crazy stuff.
Yeah, she was an adrenaline seeker, basically.
Mm-hmm.
So she went to the doctor. They thought it was a ganglion cyst. They drained it. Another one popped up on her right wrist, and now she had 2 on each wrist. So if she does a lot of movement, the cysts just come back. So
And those are common. So those things do happen, the kind of thought process. Many people have seen these things. There's like outpouching of the joint, and it's considered normal, but we consider it like, okay, the joint's inflamed. That's why it's creating these outpouches of the joints called ganglion cysts. She didn't know any of this yet. She was just kind of on her decline.
Yeah. So now we get into 2024,
So about
7 months into July.
Yeah, about 6 months ago.
And now ankle started becoming painful, specifically the left ankle, moved up to the left knee, then the right ankle, then the right knee, then the hips, shoulders, and now basically every joint she had hurt. Lots of creaking and popping in her joints, and the more active she was, the more it hurt. In September, she got so bad that she lost movement in her left side of her toes and face. So she went to the hospital in the morning.
That's crazy.
Yeah.
Right? Just pause. So we got a 31-year-old that started out with a wrist pain, ganglion cyst, now the ankle, and then hold up, now you can't move your face or your toes.
Yeah.
And you go to the hospital, and the spoiler alert again, they're about to laugh her out of there.
Basically, yeah. They thought she was pill seeking.
Mm-hmm.
So she was admitted to neurology, got a lumbar puncture, a little complicated. Yeah, but took nearly 30 minutes to get the puncture done. MRI was no stroke, negative, Guillain-Barré.
Yeah, Guillain-Barré.
Guillain-Barré. Yeah, I don't know.
You just say it fast. It sounds right. Guillain-Barré.
Guillain-Barré.
There you go.
Got it.
You got it.
She did.
So that's a progressive neurological disease that seems to start up after flu. Many times it can be without it, but it's most commonly starts at the lower extremities and works up. It can start in your arms and work up, but it typically starts at the furthest part of your body and works its way up as a progressive paralysis, and then it just goes away. It's not like ALS where it's permanent. It just kind of resolves. So kind of autoimmune, but kind of not. It's more considered a post-viral thing. There's many versions of it. That's the one I remember from med school, if anyone wants to correct me online.
Okay.
We haven't seen that here in a while.
Got it. So she did have a spinal fluid leak, gave her a slight headache, vomiting, vision issues, couldn't sit up because of the extreme pain and the blood patch.
Yeah, and so that kind of threw the whole thing. So they did a lumbar puncture, and it took way too long to do it. And so these things do happen no matter if they do it right or not. But the idea was that where they punctured her spinal column, her cerebrospinal fluid, the brain fluid, was leaking out of that. And if the hole doesn't close, it just keeps leaking. And this is the earliest invention of PRP. So conventional medicine, even though they kind of crap on PRP and say it's not that useful, they've been doing PRP for years. So it's been well known to do this quote unquote blood patch on the CSF leak, and it fixes it almost every time. So anytime someone has like an epidural for childbirth or whatnot, if they get chronic pain and there's a syndrome of the whole CSF leak, they draw blood and inject the blood back into the spinal column area, and it heals it. So it's like the earliest known use of PRP, even though conventional medicine will argue that many doctors will say PRP doesn't work, but everybody knows blood patches do.
That's cool.
So yeah, your own blood fixes the hole. Yeah. So that complicated things because she's already having these ankle issues and all that. And then that happens. And now conventional medicine has something to focus on and blame all her symptoms on. So they're chasing that down for a while until she finally gets the blood patch and it goes away. But I think, and I didn't write it down in my notes, but I think that whole process took her like a month to get figured out, to get the blood patch and stuff. They were denying it and not thinking it was part of the problem. And they finally did the blood patch and it cured it basically.
Yeah. So October, to where she is in our office, she said pretty much every joint hurts. She went into old apartments and got physically sick. She saw mold in the bathroom and felt like something funky was going on. Moved into a new home a couple of weeks before seeing us, renting a home that had been remodeled recently. And that's where she was when she was here.
Yeah, so the interesting part is that we're talking about joint pain and stuff, but she had severe limitations. So I remember her telling us like she couldn't even cook food for her kid. She couldn't stand at the kitchen stove. She
Yeah.
actually had to pull up a chair just to finish cooking a meal
Couldn't
because she was in so much
drive.
pain and such
Yeah.
severe fatigue. Didn't she have severe brain fog too?
Extremely bad. Like
Yeah.
she was, I mean, to the point that when she was talking to us, our front desk would think she was drunk or
Oh, that's
high
right.
or something because would slur her words and such. She was just really had a really hard time even functioning verbally.
So conventional medicine had tried multiple things: gabapentin to try to numb the nerve, cyclobenzaprine as a muscle relaxer, ibuprofen for anti-inflammatory. She even tried THC, CBD balms topically, and basically nothing was working by the time she came to see us. I think she had counted. She had at least seen like 6 doctors, maybe 10 doctors, because she had done multiple ER trips, seen multiple doctors in the hospital, neurologist, internist, all that. And basically they had 0 answers for her before she came to see us. We just talked to her yesterday, right? Or the day before. We
Yesterday.
talked to her yesterday, and she admitted that even when she saw us in October back then, we were telling her that mold caused all of this. And she was just like, can mold? I don't know. That sounds a bit of a stretch. And she even admitted that after she got off the visit, she started Googling all the things mold can do and quickly realized that mold can absolutely do all of this. So, as Cerise already mentioned, we had the advantage of when she became a new patient, she had actually already moved out of the moldy apartment. And we were pretty certain, despite this home being very old, that it had been remodeled recently. We felt pretty certain that it was at least mold reduced. And I know y'all hear me say it all the time, but for anybody listening, the caveat between old homes is that old homes are almost always moldy. They're just old. Like there's been water leaks, there's been water damage. The it's just old, right? That's known. But the big problem is that newer homes are built tight and they're sealed. So we typically find homes built after 1980s, especially 1990s, and definitely by the year 2000, that homes were built so tight that any small mold exposure gets sealed inside and concentrates over and over and over again, like a painter coming in and painting a wall every day. There's no time for the paint fumes to get out. Whereas homes before 1980, they're just holy. They're breathe. The windows leak, the ceilings leak, the doors leak, everything leaks. So the mold doesn't concentrate inside. So even if this 1966 home does have some mold, chances are her windows leak and her doors leak. So it's not going to concentrate inside. Now, if you do a mold test on that home, you might see high mold spores and stuff, but that's going to deceive you because a newer home may not have as many mold spores, but it's super tight and concentrated in there. Anything else in her story that you're looking through, Cerise, and you see that's important for people to know about?
Not. Yeah, I didn't.
Oh,
see
she had
anything.
severe insomnia too. She
Yeah.
would wake up from the pain. She just could not sleep.
Irregular cycles and period.
Is she vegan? Or
She
was?
was. She is not anymore.
Okay.
Yeah, she was. And that wasn't she. We got to talk more about that, and she wasn't. It wasn't a long stint for her to be vegan.
So she came to us basically with a lupus diagnosis. They call it seronegative, meaning they tested her for lupus and she didn't have any autoimmune markers of it, but they diagnosed her clinically with it because she had numerous joints inflamed. They even call her as having a TIA, like a temporary stroke. We've got another lupus patient that actually had a real stroke in her 40s, I think, from lupus, vasculitis type thing. She's got afternoon crashes, heavy periods, difficult periods, ovarian cysts, progesterone deficiency, very low iron, magnesium, zinc, B12, multiple things going on.
Yeah.
Okay. So we do our typical thing, which is make sure your home's clean, which check. We were assuming that the home was clean. We started our basic supplementation, right? We always start everyone on fish oil, B complex, glutathione. Let's pull up her list to see what we actually started her on since we're being recorded. So fish oil, vitamin D. We actually threw the kitchen sink at her.
We did.
From the
Well,
get-go.
she was willing. She was
And
very
she was
willing.
sick. She
Yeah.
was sick. So we threw Tareve out there at her, which is a 500 milligram curcumin product. And she was taking 4 pills of that. High dose vitamin D, 50,000 once a week. Magnesium, 2 pills at bedtime. B complex. Dem detox to help with some of the heavy periods. Glutathione twice a day. TrueAdapt plus NewAdapt to help with adrenals. And then we started her on some gut supplements that she was supposed to start after she sent off her stool study. And then you asked her to go gluten-free or at least reduce gluten.
Yeah.
And I guess we did ask her to ERMI test the home, but she has not ERMI tested the new home yet. Okay. So basically, and I wasn't as involved with this as I think you were. She portal messaged. She was sending us messages back and forth after our initial visit, and it was doing quite terrible. So we saw her October 11th. You had your second visit with her October 16th, so just 5 days later.
That wasn't a second visit. That was an urgent care visit.
Okay, so but y'all did meet like Zoom or something like that?
We did, and because she was discovery, we counted it like as a half of her second visit. But she was having intense systemic pain, rated at an 8 out of 10.
She was debilitated.
Basically, yeah.
Wasn't she like crying and emotional?
It was a very emotional call.
Full of despair and like, I can't live like this. Can you imagine being 31?
Yeah.
31.
She had gone to the hospital the day before, got hydrocodone. It only reduced the pain from like a 12 to a 6. She was discharged without anything else. She had this whole big argument about pill seeking.
That's right. They accused her of being a narcotic seeker, a drug seeker.
Exactly.
And she was basically like, I don't want to take drugs. I just don't want to be in pain.
Exactly. Yeah. So she was having a lot of stuff going on. Her labs, she had started doing labs, but we hadn't gotten anything back. So we were just basically scrambling to try to figure out what do we want, what do we need to do to get her pain under control and get her inflammation down. So the discussion was had that the idea would be to have her do daily glutathione infusions over 3 to 5 days and then see if that was effective. If that was effective for her, we knew that it was very likely that she was having a lot of brain inflammation, and our suspicion was from the mold exposure. So we went extremely high dose for her, 4,200 milligrams as immediate, and then the further were going to be 2,000 milligrams if she did well with it. So she was looking for somewhere in where she was. Yeah,
because she's
in
Dallas 4 hours from us.
To get it done, and she couldn't.
We can easily do this in office,
exactly.
But didn't want her to have to drive 3 hours.
Yes, but she got in the car and she got here the next day.
She already had trust issues with everyone else.
Exactly. So she got here, got it done, got it scheduled, and got here the next day and started doing it, and did. I don't remember how many infusions she did because she felt so good after the first one.
Yeah, so I'm pretty sure she's only done 2. Now she's 3 hours away, so that I'd say just 2. That's quite the commitment. She came in October 17th, so basically the day after y'all talked, and it does look like our Linda gave her 20 milliliters, which is 4,000 milligrams, and which is a huge dose. Most IV clinics, when they give you glutathione, it's 600 milligrams. That's usually the glutathione dose, and that's one of my pet peeves with these IV centers is they charge the same price as us, but give a third to a sixth as much. So 3 milliliters is being given at regular vitamin infusion places. We start with 10 milliliters, and this patient, you hit her with a sledgehammer of 20 milliliters, which is kind of the highest dose we do at 4,000 milligrams. The human body makes 14,000 milligrams on a good day, and we gave her 4,000 milligrams all at once. And I don't remember the full story. Didn't she not feel great after the infusion, but then was like the next morning?
Yeah, she had some pretty, like, nothing compared to what she was feeling, but she didn't feel amazing like in the first 24 hours, and then all of a sudden everything just flipped for her. And I forget, she called or something. Somehow she got a hold of us and told us, like, I don't know what that was, but oh my gosh. So it was
I'm looking
amazing.
at your notes. This first glutathione treatment provided significant relief from severe systemic pain. Pain described as feeling like cells had swords on fire stabbing each other.
Oh my gosh.
Her words. not hours.
Are you in the portal?
No, I'm looking at your note, your AI summary. Her
Oh,
cells had
yeah.
swords on fire, stabbing each other.
Oh, that was visit 2.5.
And it looks like you were just explaining how glutathione cleared mold toxins.
Yeah.
So she felt amazing after that first IV infusion, better than she thought she could feel.
Exactly.
And then had to do a second one, looks like in mid-November. So a month later, did another one. And your note in December, so 6 weeks later, is doing fantastic
Exactly. Yeah.
and was doing great over December. We just saw her yesterday. And as most people do, she was feeling great. And over the holidays, she decided to treat herself. And I don't remember what she ate, but it was gluten of some sort.
Yeah, she had just some gluten treats. I don't know if I made a note of exactly what it was.
And basically, it put her back in bed for 4 days, that gluten exposure. So needless to say, she now knows what gluten does to her body. Not everyone's the same, but especially as you're mold toxic, your body's just inflamed already. And yes, she's doing great, but she's not cured. She still has mold living or growing inside her. She still has mold toxins on board. And even though we've reduced her symptoms, they're just lingering right beneath the surface. And so she dipped her toes in and got a
Yeah.
leg bitten off,
She
basically.
has no space to mess around.
Yeah.
So,
But the amazing part is, so this was only 3 months ago, and since she's feeling good enough that she actually signed up for esthetician school, has been going to school for 2 weeks now.
yeah.
And she's certainly not her best, but she can at least communicate
Yeah.
and learn and go through the motions.
Well, she was, I mean, every call we've had with her has been from her bed.
Yeah,
Every
literally.
call. And
From
so yesterday
Zoom on the phone.
Yeah, when
We're
got,
not in her room at her bed. Just-
No, on Zoom. But yesterday she got on the call with you and I freaked out. I was like, "Oh my gosh, you're in a car. You're
Yeah.
driving. Like, holy smokes."
That's
She
right. Because
had-
didn't her mom bring her to the infusion,
Yes.
or her boyfriend? Mom
yeah,
brought
her
her to the
mom,
infusion.
and she had like real clothes on, not just like a t-shirt. It was amazing.
Real clothes on.
She had makeup on. Her hair was done. I was like, "Holy, this is not the same person."
Yeah.
So it was pretty.
Even when
cool.
she was sick, she did have a good bubbly personality.
Yeah.
You could tell it's definitely better now.
Oh, for sure.
But that's always, I'm sure, hard for doctors that don't understand mold to see someone that, like, you've got a good personality, but you're in severe pain and you
Yeah.
can't see it.
Yeah,
Like,
that
for-
was our first visit with her. We were like, "Oh, okay, it's not as bad as we thought it was going to be."
But she walked in our office with a walker, a 31-year-old
Yeah.
using a walker to get in, mother helping her in the door just to get in the office. And unfortunately, there's people out there still going from doctor to doctor trying to get answers. So one of the purposes of this story is to tell you that there's hope out there. Another purpose is, if you haven't investigated mold yet, it's time to start looking into mold. So a couple things now that we're kind of done with her story, and she's certainly not done with her story. We've got a much more treatment to do. But mold is kind of a we say a two-headed beast, but in this situation we'll call it a three-headed beast, because number one with any mold patient is you have to get them out of the mold. So we were lucky with this patient because she had already gotten out of the mold and she was young. So she healed really quickly. Most of our mold patients, we got to find the mold, we got to remediate the mold, then it's got to take time to clear out of the home,
After we
clear out
convince
the air.
them that it's real.
Yeah, exactly. And so the three-headed beast is one, it's in the home. Number two is it lives and grows inside us. So it lives in your GI tract, lives in your lungs, lives in your sinuses, and it's making you sick as it lives in you. That's gross. But number three is the thing that people really, really miss, and that is that mold releases toxins and chemicals. Everyone thinks this mold is spores. So yes, mold releases spores. It's trying to grow and spread itself. That's how it got into your gut and lungs and sinuses, is via its spores. But the real problem with mold are the toxic molds that release mold toxins, chemicals, gases. I like to compare it to a painter. If a painter comes into your house and paints the walls every day, it's going to smell like more and more and more paint. And eventually you're going to have headaches and nausea and all kinds of stuff because of all the paint fumes. Mold has no smell. No smell. The musty smell that goes along with some molds is actually a bacteria that grows with mold. Y'all know this already. But so don't believe that just because you don't smell mold, there's no mold in your place. Mold, and it doesn't take nearly as much mold as you would think to get sick. So number one is we always tell people to do an ERMI on their home, ERMI. If you don't know what that is, look it up. We currently using Liz Biotech, but there's EnviroBiomics, there's dust test. They're all kind of the same. Do an ERMI test on your home to find out if there's mold in it. If there is, you got to get rid of the mold from your home before you go any further. But number two is you got to kill the mold from inside you. So we use treatments and supplements and prescriptions to eradicate mold from inside people. But really number three, and where I want to focus on this case, is the mold toxins we breathe in and we absorb, and they go all over our body. This is not living, growing mold. This is a mold chemical that dissolves into our tissues, no different than drinking gasoline. I guarantee if you drank gasoline, you'd be really sick. If you inhaled too much gasoline, even though it smells really good, you would get sick. The gasoline is not alive. It's not releasing spores. It's not going to grow inside you. But the toxin can stay inside you for years if you don't clear it. So these mold toxins are what we're going to focus the rest of our discussion on. So mold toxins need to be detoxified. And the word detox is just heavily overly used in our world, unfortunately. Everyone knows about detox. Everyone knows that your body already does detox. But when we do detox, we speed it up. So there's all kinds of things we can do for detox. So what are some of the things that, let's maybe start out with some of the myths. So what are some of the myths y'all hear about detox, we hear about detox, that are just not true?
Oh, goodness.
I know where to start. The first one that comes to mind for me is the master cleanse.
Oh, yeah.
Remember that was an eye roll. Remember the whole, what is it? Water, maple syrup,
Cayenne
cayenne
juice,
pepper.
olive oil.
Yeah,
Delicious.
and you drink that.
You know way too much about that.
When you work in a
How
health
many
food store,
times have you done this master cleanse?
I have not.
Oh,
I have
okay.
not. I have not.
Yeah, so anyone listening, the master cleanse is not a cleanse of anything. It's just not good.
Yeah.
You want to do it, knock yourself out, but it's not going to cleanse you of anything. So yeah, master cleanse. What else is there?
Like detox teas, same thing.
Yeah.
Yeah.
So yeah, tea is great, water is great, hydration is important for detoxification, but drinking a cup of dandelion tea does not equate to detox.
Or like the greens powders.
Oh, that always
in
gets
there.
me. People saying like, I literally just had this discussion with my stepson. I was telling him he needs to eat more vegetables. He's like, well, I'll get a greens powder. I'm like,
No.
did I say greens powder or did I say vegetables? Well, okay, I like vegetables. He talks just like that too.
Of course. I talked to him. I know.
He's your patient. So yeah, eating the actual vegetable. Greens powders are good, sure. That's extra nutrients. I look at it as like taking a multivitamin, but you don't take a multivitamin and think you ate your vegetables.
No.
Right? There's a lot more chewing involved with eating vegetables than swallowing a multivitamin and drinking a greens powder. It's
You will
because
still die of starvation if you just eat a multivitamin.
wow, she went there.
And there you go.
Wow,
There you
now we
it,
now have
folks.
death as a side effect.
I'm just saying, if that's
Do
you're
it or
like,
die.
I don't need to eat because I took a multivitamin. That's not how it works.
Not real food. Little plug, we don't use a lot of multivitamins because we heal the gut and you absorb your nutrients from your multivitamin called broccoli and kale
Yes.
and meat.
Yes.
Okay, so what are some other crappy detox stuff that people need to know out there that they may be seeing on Instagram, and we're here
Just
to say,
do a coffee enema. You'll be fine.
oh boy. Now, coffee enemas are useful, so
They
I
can be.
will attest that is an adequate detox thing. That's a real life
when
thing.
you're ready.
But in the metaphor that we talk about, as far as real quickly, just mobilizing toxins, then processing the toxins, then eliminating the toxins, that just does one thing. That just helps you poop it out, basically. Now, it does supposedly, the coffee does supposedly irritate the liver in a way that speeds up its detox processes. So that's good and all, but it's not like you can do that all day. So that's
And that's very stressful to the liver when you haven't.
it's very
done
stressful to
any-
me.
Right. When you haven't
Some
done
people
anything
act
to
like it's no big
support
deal.
it. Yeah.
It's just, it is stressful to the liver, though.
Yeah.
Okay.
So
What about those like foot pads?
Oh, the ionic foot baths.
yeah.
Yeah.
Interesting.
Those are, I'm not going to completely say those are complete hogwash, but I'm not really sold that that's actually doing anything.
Yeah.
I don't think it's bad for you, but I really wonder if it's any good for you.
I'm gonna put it under a microscope.
Yeah.
Is
Ugh,
that really?
I don't want to.
But it does look cool.
It
You gotta
does
give 'em
look
credit.
cool. Yeah. When they can change the color of the water, that whole foot bath thing, that's interesting.
Well, since one of you went down the coffee enema, what about castor oil packs?
I think they're really helpful. I think it's kind of like the foot pads. It's like,
Uh-huh.
I think there's some good science about it, but
Uh-huh.
we just don't know.
Right, right. That's another one of those, like, gets the bowels moving. It's a real thing. We often tell patients it, but it is not a real detox thing.
Yeah, you
Yeah.
couldn't just do that.
Yeah.
Or like go to the sauna for 4 hours.
Yeah.
And just sweat it
Yeah.
all out or something.
Yeah, so sauna's a very real detox thing. Yep, big on that. But once again, just one component. You got to work top down, start to finish. Y'all know I like to use the toilet as the metaphor.
It's a good one.
So a toilet works A to Z, right? Toilet works by water up top, gravity pulls it down, pulls the poop and whatnot down the plumbing, and gravity takes it down. Sauna and things are on the bottom end of that toilet spectrum, not really adding more water in the top. So we got to remember that these toxins get trapped in our brain, get trapped in our cells, our liver, our kidneys, our heart, our toes, everywhere. And we actually have to mobilize it out of the tissue because the liver doesn't like crawl around our body and go like clean up our liver and then be like, okay, well, I guess I'll go check out the kidneys now and like crawl over there and detox our kidneys. Each organ has to mobilize its own toxin to get to the liver in order for the liver to do its work. So I'd say that's one of our big pet peeves is people doing a detox, a liver cleanse, whatever you want to call it, as if the liver does everything in the human body, like it does all the detox. But in the toilet metaphor, the liver's in the middle. It's the bowl. So it can only clean what it has access to. If you don't send any water down, well, it's not really going to do anything. So got to mobilize the toxins. What else is another?
Well, I think, just making sure all the detox pathways are open before we start mobilizing, I think just gets missed a lot.
Okay, let's go there next. I thought of one more that we don't use a lot of, and we won't disparage others for necessarily using, but our process is better, which is why we don't use it. Anybody know what I'm talking about?
Like binders? Or
Binders.
Yeah.
something? Nice.
So since you said it, why don't we use binders as much as everyone else?
Well,
And
clinically,
they're not bad.
They're not bad. But I mean, as far as like what we've seen, we haven't really seen it have the same impact as some of our other things we'll be discussing. And then too, it binds everything. So
Everything.
nutrients, your food, your supplements, and so it's a little tricky.
Yeah, it's always the hardest part but that's the main reason why, at least in our practice, we didn't really start with using a lot of binders because it's such an annoying patients. And I think one of the reasons we have such good success stories with our patients is we make things very real, very easy. Take your supplements in your morning, take your supplements in your evening, and that's about as far as we're going to push you. We have very diligent patients that will do way more, and everything's with food and without food, and they've got it all structured. But so many people just morning, evening is all they can do. Mm-hmm. And so how do you layer in binders when you're like, okay, well, take your morning supplements, take your evening supplements, but take your binders 2 hours away from that and 2 hours away from food. And then it just makes it so complicated that you can't really do it. And then it makes me wonder, well, like, why would we give you binders and glutathione? You would just bind up your glutathione. So maybe let's just do glutathione instead without binders. And so that's kind of where we started without binders in general, and have had immense success without binders. So we really don't use a lot of binders. Mm-hmm. I'd say the only patients we really use binders in are the ones that can't tolerate our detox processes. Mm-hmm. So binders, in our opinion, are kind of so minimally beneficial that they work really well for sensitive patients because they're not that powerful. Mm-hmm. But as soon as we can get them tolerating full dose binders, we upgrade them to full dose detox. So we'll give out some tips and tricks for people listening. So in the detox world, we break detox down into, everyone should break detox down into 3 categories, but I don't think many people are talking about it that way. So we break it down into 3 categories. One is mobilizing the toxin, right? Yes. Said toxin is stuck in brain. Brain must detox the toxin, but the brain is not a detox organ. So the brain has to mobilize the toxin, put it in the bloodstream, let it roam the body until it finds the liver. Because remember, the liver's not going to go to the brain, right? The toxin's got to go to the liver. The liver's going to break the toxin. Mm-hmm. After it breaks the toxin, it's got to get rid of the toxin. So that's stage 2, right? Stage 1 is mobilize out of the brain. Stage 2 is liver breaks it. Stage 3 is it's got to exit the body.
Yes.
Our exits are stool, urine, sweat. Unless you want to do a lot of crying, a lot of drooling. A lot of blowing your nose. I don't know where you know bleeding. You don't have many other exits. So yeah, the preferred routes of exit are stool, urine, and sweat. And so that's the 3 stages: mobilize, process, eliminate. So in this toilet metaphor, we always talk about it from mobilize brain to process liver to eliminate from the body. But many people make this mistake of starting top to bottom. And in the detox world, the reason why the toilet metaphor works so well, in the detox, we start with the bottom and work our way up. Because if your toilet is clogged, and you'll hear me say this all the time, if your toilet is clogged, you don't start by adding more water up top. That's how you end up with poop on the floor. Right? You start by removing the clog. You start at the bottom, and then you work your way up. Then you add more water. Right? So in detox, we start at the bottom and work our way up. So in our 5 minutes we have remaining, give people some cheats to what are some elimination things they can do. Low-hanging fruit.
movement.
Poop every day. How crazy.
Yeah.
Poop every day.
Yeah.
How
These people
crazy.
are like, oh, I go every
Lunacy.
3rd day. That is not proper elimination, especially if you truly want to detox. So, yes.
Get your shit straight. Facts.
Exactly.
Get your shit straight.
So, get your shit straight. Gotta poop daily. Figure out whatever you need. We don't care if it's magnesium. We don't care if it's aloe, fiber,
Exactly.
more
Yeah.
until you poop every day. End of story. I don't care if you're gonna like jiggle your
Healthy
legs or
poops every
get in
day.
weird positions. Poop it out.
And then hydration would be the other
Yeah.
one.
Yeah.
It's okay.
Yeah. Surprised
She
you
let
said
me have
that first, not Cerise.
True.
Yeah, you got to drink enough water. It's such a simple detox. Every time you drink water, every time you pee, that your kidneys do eliminate toxins. The liver is the most powerful detox organ, and it does prefer to detox into the bowels, but it still detoxes into the urine.
And then
And
the
then of course,
lymphatic
sweating
system,
is just
we can't
easy
forget.
elimination.
So,
No, that's
well,
it's
you
just
have to move it.
harder
so-
to do, but yeah,
Yep.
even just moving around. Yep. Okay, so there's some simple elimination things. Now, we use a lot of Equestrian cholestyramine prescription in our practice. That is about the only quote-unquote binder that we really use a lot of. I don't really consider it a binder necessarily because it's so specifically binding bile and removing it. It's probably the most powerful detox component that we use, and we use a lot of it. So if you don't know what that is, you'll need to look that up. It is a prescription. It's not something you get supplement, so you will need to talk to a doctor about prescribing it. We don't have enough time to go in full detail. So let's hit the other 2 stages at least briefly. So what are some liver detox things that we do in that processing
We use
phase?
a
Some
lot
of the components
of
we
milk
use a lot of.
thistle and alpha lipoic acid, just some supplements that are really supporting of what the liver needs to do when we do actually mobilize a toxin.
Yeah, lots of B vitamins.
Yes.
Yeah, lots of B vitamins, lots of glutathione.
Yeah.
You didn't say those first
Yeah.
because those are just so
Already.
consistent. Like everyone's on those. And it's like basic to us, but so many people have never even heard of glutathione. We always like using the B complex, not any specific B vitamins, a blended B complex that's methylated. Not everything methylated, but at least the folic acid methylated. Our glutathione dosage is around 250 milligrams. If you can't get a liposomal glutathione, don't buy it. Get NAC instead. NAC is usually 500, 600 milligrams twice a day. The glutathione is 250 twice a day. The silymarin you can do in high dosages, somewhere between 1 and 200 milligrams at bedtime is usually our recommended. We do some sulforaphane, so sulforaclear by Metagenics, and brocolinate
Yeah.
supreme or active,
like that.
brocolinate
It's
active.
by Pneumatica.
Brocolinate supreme.
Just look it up.
One of those two from Pneumatica. Yeah, the brocolinate from Pneumatica. Similar products. And then we're using some PhytoCore as kind of a blended, got weird like artichoke and other kind of detox components. Using more protein powders like Metagenics Ultra Clear that has detox stuff added to the protein powder. Protein is a piece of detoxification. We call it peptide conjugation. So eat your meat. That helps detox. I feel like that's kind of it in the detox world. Those are the big ones in the liver stage 2 processing world. And then our favorite one that we definitely don't have enough time to talk in full detail about is stage 1, the mobilizing toxins. So how do we mobilize toxins?
That was.
Yeah,
That was really
say that
great.
3 times.
Thanks.
That was a
I love it.
singing phosphatidylcholine. So our favorite product right now is BioPC Pro. It's a blended phosphatidyl compound, but majority
From
of it is
sunflower, not
phosphatidylcholine.
soy people.
Yes.
Yeah.
Good point.
I mean, if that's all you can get is soy, that's okay. But yeah, the sunflower is definitely better, less
Yeah.
toxic. We just raise our soy terribly in America. And then one of the biggest components in mobilizing toxins is fasting and the ketogenic diet, especially paired together. Keto when you're eating and fasting when you're not eating as a powerful mobilizing tool. But we use phosphorylserine in the mobilizer. We use sauna,
Yes.
butyrate. The butyrate orally doesn't work really as well, which is why we do ketogenic to generate your own butyrate. I feel like I'm missing one. What am I missing? That's the big one, keto fasting, sauna.
Yeah, it does take a lot of
Yeah,
time.
and time. Just need time to mobilize toxins. The liver can only do so much. There's only so much the body can eliminate at a time. Some of it's just based on cell turnover. If a bone cell takes 3 years to turn over, well, it's less likely to give up its goods, which is why fasting is so powerful, right? The autophagy process that kicks in after day 3 of fasting can really release some toxins, but nobody likes to do a 5-day fast, myself included. That hurts. And yeah, so we'll end with telling people about snow globing. That's what we call detox reactions. So in general, if you know anything about feeling bad during a functional medicine treatment, most people know it's called Herxheimer reaction or die-off. And so die-off is when organisms in your bowels are dying because you're killing them with herb supplements, prescriptions, whatnot, and that's a well-known phenomenon. When you're feeling bad on detox, we consider that a bad thing, and some people call that detox, some people call it Herxheimer, some people call that die-off, some people call it Herxheimer. In the detox world, we like to use a completely different term to let people know it's a completely different process. We call it snow globing. Because if you got a snow globe and you're shaking it up too much and there's too much snow, it just becomes a whiteout and not very pretty is the idea. So in the detox world, if you're pushing your detox pathways and feel bad, you're going too fast. You need to slow down. In the die-off world, in the gut world, if you're killing bugs and you feel bad, yeah, keep going. But in the detox world, if you're mobilizing more than your liver can process, you're literally shuffling toxins, not removing them. So the brain toxins go into the kidney toxins go into the brain, you've made zero progress. So don't push your detox pathways so fast that you feel bad. Okay. So our 31-year-old's doing great is the moral of the story. It's a real life story. It's one that we didn't get her on camera today, but she's a real life person that's doing great. And we've got a lot of work to do so that she's healthier and can have hopefully gluten and treats and things in the past without spending 5 days in the bed as a recovery. But mold is real. And if you don't know if you're living in mold or not, then do an ERMI on your home.
Yes.
Moral of the
Before
story.
you wreck yourself.
Check yourself.
You're welcome.
All right. Thank you guys. All right. Thank you guys. Well done.